We have data-driven community grant funding, and in the same vein, I guess, as Tahia, it's another look at how data can inform smart decision-making, smart interventions. And we're hearing from Alanna Irving, Maria Ngawati, and Marianna Pekar from Internal Affairs. So welcome up, and I'll let you take it from here.
Tēnā koutou katoa, ngā mihi nui kia koutou, nā koutou I whāriki tēnei o ngā kaupapa. Ko mātou tēnei ngā kaimahi ki roto I te taritai whenua, DIA, no mātou te honore, te kōrero hia inei taki tēnei rā. So as we come up, we're just going to introduce ourselves. My name is Marianna Ngawati, he iri a hau no ngā tihine, no ngā pehi me ngā te poro. And I'm going to hand to Alanna to get us started.
Tēnā koutou katoa, ko Alanna Irving, toko ingoa. My job title is Practice Lead Outcomes at Department of Internal Affairs. I had no idea what that job title meant when I took this job, but I figured it out. How do I click forward? Here we go. So I'm here to talk to you about a journey of outputs to outcomes. We're on a long-term journey in the lottery grant space. I feel like Tahia's kōrero was a really good introduction to what we're going to speak about today. We're trying to apply some of those ideas about using data to inform good decision-making in the lottery grant system. And answering key questions like, is the system having impact for community hapu and iwi? How do we know whether the money is actually going to where it's needed the most? A lot of this work was kicked off in a change program called Kia Tipua He Tipua, which started back in 2020 before I was with the department, but identified some really key changes to evolve the lottery grant system. So the lottery grant system is quite big. Some people don't realize the Lottery Grants Board allocates $500 million a year, or nearly $500 million a year, in community grant funding. And the system hadn't really gone through any significant strategic change since its inception more than 35 years ago. It was 35 years when this change program was getting started. So it was quite an ambitious change program, did a lot of consultation with community hapu and iwi, with users of the system, a lot of input from staff at Internal Affairs and stakeholders, and of course guidance from the Lottery Grants Board and leadership, and identified some really key changes that needed to come, making a system that's high trust with equitable outcomes, that's community-centered and has a future-focused approach. And a really big part of this was an aspiration to have a system that is strategy-led, data-driven, and learning, so it wouldn't be another 35 years before the system evolved again, that it could be continuously improving. The Lottery Grants Board put out a statement of intent for the first time in its history very recently. We've been sort of engaging with community for a long time about this document, but it was officially published, when was it, June? Very recently, this year. The statement of intent is quite a long-term, aspirational, high-level vision from the board. They were talking about 50-year time horizons of the impact that they'd like the whole system to have. And a lot of my job and the job of my team has been to try to interpret that very high-level aspirational guidance into much more detailed, tangible models and tools that the system can use to help achieve that vision, and also to measure whether that vision, we're on track towards that vision. So a really key aspect of the statement of intent is a focus on outcomes. So the three outcomes in the middle of this circle are those 50-year time horizon aspirations that the Lottery Grants Board set out of social cohesion, community well-being, and self-determination. Another extremely important aspect for us in the system is the legislation, part of the Gambling Act that defines what the lottery grant system is supposed to achieve and be about. The combination of those two things, plus some key fundamental elements such as the principle of equity and te tiriti o Waitangi, all combined together for us to develop, okay, given all of that, what are the actual outcomes that the system is meant to be achieving? There are 9 mid-horizon outcomes. We're using a metaphor of horizons, near horizon, mid-horizon, and far horizon, to talk about the level of specificity of the outcomes that we're talking about. So those 3 far horizon outcomes are very high level and not very specific. Mid-horizon outcomes are starting to get more specific, talking about the different domains that we would need to grant into. But just to be clear, it's not everything to do with these domains. It's specifically the things in these 9 domains in the rainbow part of the diagram which most further social cohesion, community well-being, and collective self-determination, and most represent the guidance from the Gambling Act and the key elements like equity and taititi. And so if you combine all those things together, you end up with quite a lot of outcomes. We have 189 near-horizon outcomes. I'm not going to show them all to you, but it really helps the system to understand in detail, well, what are we meant to be focusing on here? What are we meant to be prioritizing? And I'm handing over to my colleague, Maria. Kia ora. Just press the middle
So
button.
when we came on board, so this is my first foray into being a public servant. So I've been here for 18 months. When we came into this job, we weren't very well aligned with the Gambling Act in terms of legislation. So that was our first job, was to look at grant allocation and really ask the question, do we know where the money's going to? Is the money going to these communities? And then what impact is it having on these benefit communities? So to make sure that our board was being compliant with legislation, first and foremost. In the legislation, there's what we call groups named in the Act. And it covers 8 groups. So Māori, Pacifica, ethnic communities, youth, elderly, those that experience barriers to participation, and ethnic communities. Did I get all of them? And women. So there's 8 of them. So if you can imagine trying to find these population groups within Aotearoa, at a level that enables us to compare neighbourhood to neighbourhood. Those of you that work in mapping, GIS, I see a few people. So lots of learnings for us as a team. But first and foremost, we are there for one of the board's missions, of course, is to look at equitable distribution of grant allocation. And then, as Alanna said, a focus on outcomes. So I don't want to underestimate or understate the really big shift that we had to take our organisation through. So the board is committed to ensuring funding processes are inclusive, efficient, and aligned with community aspirations, right? So the first criteria coming into for any applicant is it for community purpose? That's the first criteria. And how are we going to do that? So the aspiration was that we're going to simplify the funding applications. It's a work on. All of this is a work on. So you've got more of a seamless experience when you come in as an applicant. My personal interaction with the system was first and foremost as an applicant. So I'm helping to build, marae projects and wakaama clubs and all the things we do in our day-to-day life as applicants. So I've got a unique perspective. I've been on both sides of the fence. We want to represent diverse perspectives, again with the lens of equity, prioritising outcomes and then impact. There's some really great conversations going on outside of government too around social value, impact measurement frameworks, amplifying community voice, all of these conversations in terms of measuring impact in line with outcomes. Fostering collaboration between agencies and funders. One of the examples that I can talk about is working with TPK, for example, in aspiring to look at some of the principles of Māori data sovereignty, so getting back to the head nodders around the maps, looking at mapping SA2 to iwi boundaries, for example. All these issues affect everyone, and so hopefully through our project we might be able to lend some discussion to this conversation, I guess. Maintaining an active feedback loop with those communities, hapu and iwi, to inform decision-making, what the previous speaker was speaking about. In this emerging area of Māori data sovereignty, what does it mean for government, and what does it mean for iwi and hapu and whānau? So we decided to undertake this very ambitious project around forming a composite index. So why do we need a composite index? And I just want to pause there and mihi to everyone that's ever been involved in New Zealand Deep Index or the multiple index of deprivation for all the work that's been done previously. However, it wasn't really fit for purpose for us, mostly because of those groups named in the Act and the level of specificity that we needed to get to establish need. So the lack of stakeholder engagement too around using those two methods. We needed to hear community voice, what variables and what indicators matter to them. And we've got some really interesting learning around what's actually in the IDI at present and what some of the opportunities are for our communities that aren't well represented at the moment. A focus on outcomes. So not only did we want to start measuring where the money was going, to whom it was going to, the impact into those communities, but we wanted to actually get data focused on outcomes. And the level of accountability and transparency to community, to hapu and iwi, so we can definitively say this is the benefit into those communities. And now I'm going to hand to our actual data scientist person.
Thank you very much, Maria. Ko Marianna toko ingoa. My name is Marianna Pekar, and I worked alongside Alanna, Maria, and a number of our colleagues to build a composite index, but also a dashboard that a large number of our colleagues use. And those colleagues are community advisors who are in direct contact with the community, and they not just helping with recommendations where this $400 million per annum goes in community funding, but they also have the ability to observe their community and even drive applications if they feel that there aren't enough grant applications where it's needed. It is also the distribution committee members who look at the recommendations of the community advisors about granting and helping them to make a decision. And finally, the lottery board that is accountable for whether this money is really being spent at the outcome areas and also for the right populations that are named in the Act. I just step back a little bit. This slide shows you the numerous layers of the considerations we had to do when designing a composite index. But you might ask why we decided to do a composite index. Well, the outcome areas all have measures or proxies in the IDI and also outside of them. And we went through a rigorous process matching potential indicators to outcome areas. I did quite a thorough systematic literature review regarding sources in New Zealand and also outside of New Zealand international publications on how one can measure social inclusion, equity, and barriers to participations in society. And what are the best proxies that we can see in secondary data sources, because we are unable to roll out a large survey that stays representative at a neighborhood level. So that's not our space at DIE right now. Maybe in the future we can do that, but we couldn't, so we had to look at already existing data sources to have measures. Many measures came into a consideration, but our community advisors have such little time to make decisions. They can't look at 30, 40, 50 measures. So we wanted to have one composite measure that really helps with decision making, not making their life harder, but making their life easier. And if there are sort of odd cases, then they can drill down and look at the measures, the outcome areas, and within that, the right measures to get more information. So we considered, as I mentioned, social inclusion, equity, and barriers to participation. Spatial analysis is a big part because everybody exists somewhere We can't do individual level outcomes measurement because that's not how granting system operates. It focuses in communities, but there is a well-recorded benefit location, and that is kind of like a neighborhood or suburb level. We also had to have a consideration to the populations that are named in the Act and the intersectionality. Like one person can be many categories within that Act. You can be disabled, Pacifica, female, and so on. So I think one interesting thing I wanted to show you is how we worked on a spatial level. This is part of Christchurch, and I'm showing you Land Information New Zealand suburbs and localities. So that's Opawa. And there you can see kind of like a yellow shading and underneath blue. The blue shading is statistical area unit levels. So those are in IDI, usually most population measures can be rolled up from mesh block to SA1, SA2, SA3, and so on. So that's kind of like a standard geography used in IDI. And it's really great for population-based research because it's always based on kind of a similar number of people, 1,000 to 4,000. And they update it regularly, yearly, to show population shifts. While the lens, the yellow area isn't. So that's cadastral boundaries that don't change much over time, and most people know these when they talk about their neighborhoods. So you don't think about Miramar east, west, and south, you think about Miramar. And we tested both of these potential geographies with community advisors and also applicants, and they showed a strong preference to LINS. While it's here, it's perfectly aligned to one or multiple SA2s in this particular Christchurch area, but it isn't like that everywhere in New Zealand. For example, here, it's still an urban area, Fendalton. If we would just go for a suburb to SA2, then some built-up areas would be missed, because the LINS locality kind of like stretches outside of the blue area. And if we're looking at truly rural areas, then the LINS boundaries are usually smaller than the SA2s because very few people live there. So to get that 1,000 to 4,000 people together, the area has to be bigger. So that's kind of like shows that you can't do a good mapping. Like a one-to-one mapping, you will always have errors, but we kind of had to work with that and developed a concordance system that quite generously distributes the LINS, translates between LINS and SA2, so we can still work on our population-based indicators and composite index being built in SA2, but we can link it to how the data arrives into the granting system through LINS. And we are opening it for public, so if people want to use it, they can. We contacted LINS. They don't do this because, as they explain this process, it's an unholy smoosh. Works for some people, not for others. We had to prioritize our users, and that's what we did. It's less about how perfect this is and more about that we provide information to our community advisors about the populations that those grants will, help benefit from. So the composite index has a multi-layered approach, as usually it is like that. We have the large domains that Alanna introduced, the 9 mid-horizon outcomes. We matched the indicators that were well-researched, grounded in literature, but also discussed with our community groups. There is kind of like a mid-level in between, like subdomains. So I tell you an example. We have an economic domain that has such things as median income, low work intensity indicator, benefit receipt, tier 1 benefit receipt, but it also has another subdomain that measures social inequality and that looks at age stratified income gap between our priority populations and this counterfactual group that is not priority population. So we have Maori versus a counterfactual group that is non-Maori, non-Pacific, and non-ethnic communities. And so instead of having percentage of Maori living in that suburb as an input-based measure, that's not what indicates need. What indicates need is there equality? Is there equity between these groups named in the Act and the people who are not? And weighing, so we have a large amount of indicators, and we decided not to do a subjective expert-based weighing like NZDEP does. For example, we did an algorithmic-based weighing that we had some oversight on, which is it's quite a long process. I'm happy to answer questions about that later. But basically, if a variable shows much more variance across suburbs that has a higher weighting than others that are kind of don't make so much of a difference. And I guess this process is quite lengthy. You know, we had to use imputation methods, treat outliers, observe the structure of the data, you know, like are there certain variables that are highly correlating, and if they do, let's choose the one that's more meaningful or less imputation was needed instead of doubling up. There are certain standardization methods, weighing systems that we did sensitivity testing on. And we are using methods that are grounded in OECD's handbook for composite index measurement and has been tried and used, but is very different from the New Zealand Deprivation Index methodology that was developed in 1991. I've got kind of like an example of how it is being used. So we do display I'm unable to do a live demo because we weren't cleared for that, because we have some information that's not for the public, but we are working on a publicly available dashboard as well. So I'm going to just show you like a small example of how this is different from NZDEP. You can see on the first picture is New Zealand Deprivation Index. I chose particular suburb to look at that's close nearby, the Wellington Botanic Gardens. So it's kind of like a medium density, lot of renters, and obviously, you know, like we know what is the New Zealand Deprivation Index. It's number 5 when it's measured on a scale from 1 to 10. 10 meaning worst outcomes, 1 meaning best outcomes, and the second picture is our composite index. The big difference is really that it's not logged in the census. It prioritizes admin data, which might be useful once we don't really have some of this information anymore, once we don't, you know, census changes. It is also transparent and drillable, which means that the larger outcome areas have their own 1 to 10 scoring as well. So that if you want to drill down what that number means in NZDEP, you can't, but in this index you are able to. And it's quite custom built for our legislation. So it is grounded in our outcomes framework. So in our composite index, it receives, Wellington Botanic Gardens receives a 2, which is a lot better than what it would be if you just look at deprivation. And the third picture shows you why is it like that, and such things as environmental well-being, capacity, self-reliance are pulling this measure up, making it better, while the economic well-being isn't that great. If we drill down a bit more, then you can see one of the reasons is that the socioeconomic inequality measure, so when you look at populations, each stratified incomes versus the counterfactual, is actually not too bad. It's better than average, because that's why it's a 3. These are deciles. And if we look at it a bit more, the other one was the environmental indicator. This map shows, I think, we have commuting to education and also to work using active transport, so walking, cycling, and so on. And that's relatively good if you live there. 80% of people, according to the last census, used active transport to commute to education. I think for work it was something similar. And we were talking about the socioeconomic inequality measure. That was a 3, so that was better than average. This number you can see there, that calculated value, the age stratified income gap between Maori and non-Maori, non-Pacifica, non-ethnic communities, counterfactual group. And it's actually a positive number, which is rare, meaning that Maori are earning a bit better who live there. If you go to this Northland left from it, it's a negative number, well in the 10,000s. So that's kind of like the capability that people can do, whether they rely on the composite index or they rely on, or they want to dig deeper, they have the opportunity to do that. I thought I'd share a couple things, like advice that we discovered as we were rolling out this dashboard to like hundreds of people. And I think, one of the most important principles is that we build the data assets as well as the dashboard, like if it would be helping our own decision to make the system better. So we are designing dashboards not as reports, but as live tools that we would like to know before we distribute those funds to communities. We started with people and not tech, so we engaged with all of those 3 users, the community advisors, distribution committees, and the board, to understand how they would use this data in their decision making. Second one, we had to connect outcomes to grants, which we did through a common geography, because we can't connect it through people. It's just the system is not like that. We don't know who exactly benefits from the grants. We just know the organizations and where they deploy. The third one was that we had to fill data gaps. We didn't have everything. So sometimes we had to backfill algorithmically or even manually, actually. But what's even better is that we influenced the data collection system going forward, so that doesn't have to be done anymore. And it's probably going to be a lot better quality than what we managed to backfill with the help of our colleagues. And third one is that iterated like it's a data product. So you have to test with users, train staff, roll that in phases. Don't try to build something for 2 years and aim for perfection. It has to be shown to people. And I guess, it's a living product. It's continuously improving. We are always seeking feedback.
Thanks, Marianna. I'm so glad you're here to explain all the complicated data scientist stuff I would never be able to explain. I just want to wrap up with a couple of comments to say that, as Marianna just mentioned, this work is still evolving. As I said, the goal is for lotteries to become a learning system that's continuously evolving, so this work will never be done. But we do have our dashboards and our composite index now in use, and our outcomes model has now been officially declared as the basis for granting prioritization. So we'll see that influencing the actual granting decisions this year and into the future. If you would like to know more about our outcomes model, you can go to the Community Matters website. It's all the information about the granting programs that DIA administers. And we've put, for transparency, we put our whole model up there and explained how it works and how it's used and why it was made the way that it's made, so you can have a look. We'll also be doing a webinar with Philanthropy New Zealand on the 3rd of October to explain more about our model and answer more questions from the philanthropy sector. As Marianna mentioned, we will be doing a public-facing dashboard at some point, ideally this financial year, if everything works out. But yeah, just to say that we're on a journey. We're on a long-term journey. So we have been following something we're calling internally a data maturity roadmap, which is essentially just saying we want to get better at data-driven ways of working in the lottery system. We identified different levels. The first level that we're working on now is really about aligning decision-making to what the strategy says and what the law says we're meant to be prioritizing. The level coming up, which we're starting internally looking in now, is about impact measurement. Okay, we made decisions with the best intentions. Have we measured those decisions? Now, what was the actual outcome? What was the actual impact for community hapu and iwi? Those are levels 1 and 2. There's more levels ahead of that, but we started really at level 0 because lotteries hasn't been in the past a very data-driven system. So it's not to say this is the first year we've had a clear strategy and data to measure that. A lot of amazing things were done in the past. Lots of great decisions were made, amazing, impactful things were funded, but we just didn't have a system to actually let the system see itself and measure itself over time. And so that's what's going to be changing going forward, is we'll be able to track and really know what's happening. Data and a composite index is never going to be the decision maker. An algorithm will never be deciding granting. It's an augment or a support to the actual decision makers, and that's actually really important, that we're combining the composite index of the data with the human intelligence that we have actually in spades in our area of Department of Internal Affairs is full of people who are on the ground, out in communities, plugged in, really know their area, really know their topic of granting. And if we combine that contextual knowledge and human decision-making with really good data, I think we're going to see continuous improvement towards really great outcomes from the lottery system. Well, thank you for having us today.
Thanks very much, you three. We do have a couple of questions on Slido. Sure. I'll just lean in so the microphone picks me up, and then I'll put it to you. I'll just ask the first one. There are a few other similar indexes and models out there. I can think of the one from Ministry of Education, which has replaced the one for decile funding in schools. Do you feel like your composite model might have something to offer in other areas besides lottery grants? Is there any conversation that you're having with other agencies about here's our model, here's your model, can we learn from each other?
I might throw this to my colleagues in a moment, but just to say we are planning, ideally, to publish a research paper about our composite index so we can share a bit more about our methodology on the research basis behind what we're doing. I hope that some of our learnings can be helpful to other people interested in indices. However, keep in mind that our index has been really custom-made for the lotteries context. It's really designed with our part of the legislation and the strategy that the long-term horizon outcomes that the board has set. So it probably wouldn't be a copy-paste into another context, but maybe the methodology or the way we've gone about it could be helpful. Yeah, do you want to speak to that?
We have been talking to Ministry of Health about their health rurality or accessibility index. So we had some conversations with others that have specific indices that they develop for their own purposes. I also wanted to add that the methodology is very transparent, and OECD has published on our package that can be followed through using their handbook. So, if anybody wants to have just the index methodology, plugging in their own measures and creating a composite index, that is a helpful start.
I'll probably just add the learnings that we've found along the way because of the shift, away from the census to more administrative data, the gaps for our most vulnerable communities. And so that's some of the learnings we'd like to share as part of our published research as well.
Great. Next question. So often the volunteers that fund... hang on, I'll just have to reframe that, I think. I'll go to the next one. I need to think about how that one's meant to be worded. What were the input variables that were most closely correlated with a high score on your index
I love this question. It was quite highly correlated with NZDEP. I would say that the R squared was about 0.73 or 4, something like that. So it is, a large part of it is related to deprivation. I would say that's the number one.
Yep. And then I've figured out what was happening. There's often the volunteers that need funding the most lack the education and skills to apply for the right funding. So how do you make this data accessible for them?
Yeah, that's a really great question, and that was a big driver of a lot of this work. We're trying to get putea out to the people who need it the most, and that's not always the people who have the most experience in grant application systems or reading data and all that stuff, but they have really important mahi that they need to be doing with their communities. So it's been a multifaceted approach. Maria spoke to the efforts to simplify the application process. So we did a pretty deep design sprint where we thought, we need to collect much more detailed data so that we can do the measurement side of all of this and accountability and targeting. However, we really can't outsource that complexity onto Community Hapuniwi, onto our applicants, because that does not make the system easier, fairer, more accessible. So we ended up coming up with a kind of a multi-step process where the questions on the actual application forms are very simple. It's essentially like, who are you? Tell us about your community. What would you like to do? What are you going to use the money for? In your own words. And then we have staff members who receive that and translate from what they understand from what has been put in the application into structured data. So location, benefit location, the outcomes in our model that the grant most links to. So we don't ask applicants to understand our whole complex model with 189 outcomes or anything about our data or anything like that. And also which groups in the Act does this grant benefit. And that's also really important because people who are sort of, really savvy grant writers will read our legislation and go, they're supposed to be prioritizing these groups. I'm going to name them all in my application and hit all the keywords, whereas somebody else might not know to do that or not think of it that way. So we need to make sure that we're having a good look at that and asking ourselves, is this kaupapa really designed to be targeted to benefit this named group, or is it actually more of a generalist kaupapa? A program that the general public is invited to and maybe a disabled person would turn up to is not the same thing as a program which is by and for disabled people. So we looked at that. We do some structured data assessment, and then there's another step where community advisors who are out in the field, and I'd say that's one of the biggest strengths of the lottery grant system, is we have awesome people out there in the community who really actually know the groups that we grant to and have genuine relationships with them. They have another look at it and go, has the structured data been put in there accurately? Well, this person didn't talk about this aspect of their work or this area that they work in, but I know this group and I know where they are, what they do, so we're going to make sure that we get that data a little more accurate. And so through those multi-step processes, then it flows through into our dashboards, hopefully in a more accurate state without making this whole system really complex for applicants.
Great. Well, thank you once again. Great work.